good way to talk to, too.
Well, you know,
That's enough introduction, and I go into it, because otherwise you take more than a minute, and then you defeat the whole purpose of hypnosis.
Okay, Johnny, now you just pretend you're all listening to that. And you just watch my fingers, open your eyes. Way big wide. Big wide, Johnny. I'm going to close your eyes. Close your eyes. Close your eyes. Relax.
No, pretend.
Pretend. Be careful. And pretend you're watching them. Pretend you're watching them. Look over on your belly. Wham them. Just hurt your arm. Now, Johnny, you can open up your eyes. It didn't hurt one bit.
Now, you don't say that hurt. You leave out that word. But outside of that, that's awfully good for a first practice, because that's really your first practice. But don't use that word hurt with a child or an adult. Once you get them into the suggestible state, you use the word hurt, and you are just like reversing hypnosis. Instead of getting a good result, you get a horrible. I know it. So you say to the child, you won't feel it. You won't notice it. Anything I have to do now, you'll be able to tell I'm doing it, but you won't feel it. They know, but hurt, the hurt is that's a poisonous word to a child or an adult. All right, doctor. Did you practice yet? All right, we'll have you practice next.
What was your first name? Vic. Okay. Well, I'm a dentist, Vic. Vic, now I know that coming to the dentist is no fun for you, but I think we've got a way that it could be fun. And all you have to do is pretend. Do you like to pretend? All right, well, we're just going to play a little game here today, and as long as you keep playing the game with me, you're just going to get along fine. Now, I'm going to take my fingers and just pull your eyes closed. Can you look up here at my fingers and open your eyes real wide? Fine. I'm just going to pull your eyes closed. Now, I want you to just pretend those eyes just won't open. They just won't open. Now, all you have to do is keep playing this game, and you're just playing it swell. And we're going to repair a few little holes here in your teeth, and you're just going to get along fine. Now, all you have to do is keep pretending. Can you open for me, Vic?
Now, wait, I want you to see that you've actually got anesthesia there, and I want you to see that, because it's important that you fellows who are first working with this realize that I'm not fooling when I say you've got anesthesia. Go in there and just let me see how little you feel.
Now open wide.
No, you're working there, but you won't bother. All right. No, that's all right. That was a flinch of fear, Doctor. And learn to recognize fear and pain. There's a difference. That was a flinch of fear. Now, get rid of the fear. Go right back in there. Pretend you can't open your eyes. That's all you have to do, and you won't feel anything.
You play the game, Vic. Just keep playing the game with me. Now open, Vic. That's fine.
When the fear is gone, you won't feel it. See that? Did the same thing and did it harder, and he didn't feel it. There's a difference.
Now we've got them all fixed up, Vic. When I tell you open your eyes, you're going to just feel swell. Now open your eyes. How do you feel?
First time you were scared, second time you didn't feel it. Right?
Did you feel it?
That was fear that you felt.
How about the last time?
Did you feel the last time? He did it harder the second time than he did
yeah,
it first.
That's true. The second time.
Because of what I told him, he said, "No, wait, I got to know that what I'm working with hypnosis is what this man says." He gave you a tougher test the second time than he did. I saw him, and I can verify it. Is that correct, Doctor? You didn't feel it the second time, did you? No, because you were really playing the game the second time. The minute I said, "Get rid of that fear," you said, "Oh, well, look." And you got rid of it, you did all right. All right, now, Doctor, take him as the adult.
All right.
And see. And see. For your benefit, I want to tell you that most people are scared of the dental chair. Well, and that if the dentist can remove the fear, he generally removes about 90% of the feeling. Isn't that right?
Yeah.
Sure.
Vic, we've done quite a bit of work on you, and I noticed you're pretty well beat out when we get through, and I think I've got a way here that we can relax you and so that you can enjoy coming down here and it won't be such a chore. Are you interested?
Yes.
All right, now, I'm just going to take my fingers. You open your eyes real wide. Take my fingers and we're just going to pull your eyes closed. And I want you to just relax those muscles that were under my fingers until your eyes just won't open. And when you're sure they just won't open, I want you to test them so that you're sure they just won't open. That's fine. Now, when I raise your hand, I want you to just let that relaxation just go all the way to your toes. That's fine. Now then, you're just so relaxed and so comfortable. Now would you open, please, Vic?
That's all right. No, that's all right. You didn't have to test the second time. Because as long as you did the first time, you know that you got it.
Mm-hmm.
Now close your eyes again. Bring them out the right way.
All right, Vic. Now, we're all through here, and I want you to open your eyes, and you're just going to feel swell. Now, open your eyes.
Now, Doctor, the one thing you've got to remember is make a difference between open the mouth and open the eyes.
I see.
You see what I mean?
Now,
because he understood you when you said
when
open.
I said open,
he opened the eyes
Uh-huh.
instead of his mouth, and you would think you'd lost the state. You didn't lose the state.
Mm-hmm.
But be sure that you say, now when I have you open that mouth, make the difference. And, it's very nicely done, Doctor. You did some nice practice this week, didn't you?
Yeah, I did.
Yeah, I thought you did. Friends, for the most part, I was very pleased with the work tonight, but there were certain disappointments that I had. Certain things haven't come clear to you yet. Now, why that is, I don't know, unless some shortcoming of the teacher. It could be. I want you to know that you haven't made a differentiation about where your hypnosis begins and where it lets off. Now, you can't just get the relaxed state and expect to have deep anesthesia at that point. You'll have a threshold change, but you will not have deep anesthesia. You've got to add your selective thinking before you have your hypnosis. And too many of you were anxious to go to work before you had inserted the selective thinking. It's just as though you must say to yourself, here, I have the state now in which selective thinking is possible, but I don't begin my work until the selective thinking is there and fully established. You must establish the selective thinking. You can't just get the state and go right to work unless you know how, like myself, to add selective thinking with just a word. Now, as you get more and more experience, you'll get to be like me, so that one word will establish selective thinking. But where you aren't like me yet, be sure you get that selective thinking in there before you start to work. If you don't, you won't have the state. Outside of that, I was delighted. Only one or two of the people coming up to practice use the words hurt or pain or anything like that. And most of you have already gotten away from now you can't open your eyes, and you realize that that's a challenge, whereas the right way to say it is now those eye muscles won't work. But when you're working with a child, you do say, pretend you can't open your eyes. That's a direct approach to the child. But to the adult, it must be an indirect approach. You're approaching the child at the child level, the adult at the adult level. Let's go on from there. While the method that you've learned tonight is probably the best method in the world for normal children, it is certainly not a good method for brats. Brats need a technique all their own. And I don't want you to use this two-finger eye closure method on brats. It's not good for them, because they won't pretend, they won't do what you ask them to do. But there is a technique, however, which is very effective for brats, and it will help you with about 3 out of 4 of your brats. I wish I had a technique that was 100% effective on brats. I haven't. I don't think anybody in the world has. But at least it's about 75% effective. Some of our doctors have found it 100% effective for them, and I hope you find it 100% effective for you. But 75%, if you can have 4 brats, we'll say, and 3 of them become normal children, and the 4th one still stays the brat, well, you've still done a pretty good job. That's better than you've been able to do in the past. And when I talk about the brat, I'm talking about the 4-cornered problem, where you have to give them a shot, and you have to call in your 2 nurses and your secretary, and then you've got to hold down another area, and then try to jab them with a needle at the same time. I'm talking about the person who comes into the dentist's office screaming, yelling out in the waiting room, and irritating every patient who's out there, and irritating the dentist because he says every time that little kid comes in here, he ruins 4 patients for me. Because that's what that brat does. He instills fear in the minds of other patients, and the dentist isn't glad to see him. But there is a way to handle that brat. Now, I would like one of the ladies that I've never... Here, suppose you come on up, will you? Now, we realize that this young lady is not a brat, but I've got to have someone to show this technique on. When you hear... Would you just pull that chair up, please? When you hear that brat yelling out in the outer office, at the earliest opportunity, go out to that child. Usually that brat is accompanied by the crutch, the person to whom the child is yelling, "Mom, take me home, I don't want to see the doctor." You know the type I'm talking about. Go out and talk to the child like this. "Oh, what's your first name?" Waldine. "Oh, Waldine, you're just the girl I want to see." "I don't want to see you, Mom, take me home," is generally the brat's answer. And the mother says, "No, Waldine, you came here to see the doctor, and you're not going home until you've seen that doctor." And then continue with the child. "You know, Waldine, I'm not fooling when I said I wanted to see you, because I learned a little game this week, and if you learn to play it, nothing that we do in this office will bother or disturb you from then on. You'll never be afraid to come here if you learn this little game that I know. Now leave the child and go back into your own office. And you'll find that your nurse or secretary or a receptionist will report to you that the following conversation almost invariably takes place. 'Hey, Mom, he's lying, isn't he?' 'Well, what do you mean he's lying?' 'There ain't no such game.' 'What do you mean there's no such game?' 'Well, he says there's a game, and if I learn it, that it won't hurt me anymore when I come to this office. He's lying, ain't he?' 'Well, I don't think he'd tell you that unless he knew what he was talking about.' 'I wish there was such a game, but there isn't. And take me home.' But no, the mother insists on keeping them. Now, finally, it comes turn for the little brat to come into the office. And when that little brat comes into the office, separate the brat from the crutch. If you don't, this method is not effective, because if the child can lean on that crutch, he won't lean on you. And that child must lean on you in this technique. Now, when you get the child alone, you get him to the table like this. Waldine, would you bring your chair up here? Look, you know, I told you a while ago that I know a little game. And if you learn this little game, nothing that happens in this office will bother or disturb you from that time on. Now, I wasn't fooling you, because I really know such a game. And you just won't feel anything if you learn this little game. So I'm going to teach it to you. Would you like to learn it? Mm-hmm. All right. Pull your chair right close up here. And that looks like just an ordinary top to you, doesn't it? Mm-hmm. But it's a magic top. You've got to do just what I tell you to do when I tell you to do it. And don't do anything but what I tell you to do. And then you're going to be playing the magic game that will help you so much that you won't feel anything that we have to do in this office. Now watch the top. Now watch it. Watch it. Are you watching it? Lean right over to it. Lean right over to it. Now do just as I tell you. Now close your eyes and sleep. And you'll find you can't open your eyes. They're locked. The harder you try to open them, the less they'll open. And you'll find yourself going into a soft, deep sleep from which you will not and cannot wake up until I tell you to. You'll find that from now on, you'll never be afraid of the doctor again, because the doctor is here to help you. He's not here to make you feel things. He's here so that you won't feel things, so that you'll never have to be sick, so that you can be healthy all the time and have wonderful teeth and be a healthy, happy little girl. And now, just because you're playing this game so well, nothing that happens in this office will bother or disturb you. In just a minute, I'm going to have you open your eyes, and I'm going to take you over to the dental chair, and I'm going to have you sit down in it. And when you sit down, your eyes will close again, and you'll be asleep just as you are now, and I'll be able to work on your teeth, and you'll be fast and sound asleep. Now, when you open your eyes, there'll be a chair right next to you. There'll be a chair right next to you. Here. And that will be the dental chair. And when you sit down in that chair and close your eyes, from then on you won't feel a thing that happens in this office. All right, Waldine, you can open your eyes now. Now sit in that chair, will you, please? Now, I'd like to ask some dentists to come up here. And I think you'll be delighted with what you find. Just close your eyes, please. Now go in there and you'll find she doesn't feel anything. Yeah, sure. Just open your mouth, Waldine. You won't feel anything. Beautiful anesthesia, Doctor. And you see, it works. It works beautifully. And the child is no longer the brat, and the child is no longer afraid to come into the dental office or the medical office And from this time on, that child becomes your friend, and you'll just love it. Now, when I have you open your eyes, Waldine, you'll never be afraid to go to the dentist again. You'll never be afraid to go to the physician again. And when the doctor works on you, you know you can close your eyes like this, and you just won't feel anything at any time. Now open your eyes and notice how good you feel. How do you feel?
Fine.
What did you feel, Waldine, while he was working on you?
Well, he done something in my mouth.
Did it bother you?
No.
No. So you see, you made a good test, doctor? So you see, it's a pretty good device. This technique, if you knew how good it was on Brats, you'd realize why we put it on the second side of the second record. We regard it as one of the most valuable techniques that we teach. And it's up to you to practice it, because this is one technique that you can't practice in class. But it's on the record, and it tells you exactly how to do it and what to do with it. When you get Brats, and the average doctor sees a few of them a year at least, it's a technique that is priceless when you need it. Because when you need this technique, you need it. This is something that will help you with that impossible child. So try it, and I think you'll be delighted with it. All right, now, would you mind sitting here? I'll probably need you for some other things. Now, the two-finger eye closure method is excellent for normal kids, but use the top on the Brats. Also, what about the pinwheel? That little pinwheel that goes on the baby carriages, where mothers have the babies watch the pinwheel as it is blown by the wind, and the kid watches it fascinatedly. That, too, is a good substitute for the top. But I find that when I'm called into the doctor's office and have to deal with recalcitrant children, that my best bet is a coin, because I don't have the top with me all the time. And you may find that while you've got the brat is in this office, but your top is way over in the third office over. When that happens, use a coin. I keep a silver dollar in my pocket at all times. Spin the coin, watch it. Are you watching? All right, now close your eyes and sleep. And don't hesitate to use the voice of authority. It's the one time in all the training that I give you that I tell you to use the voice of authority. You never use the voice of authority when you're dealing with a normal child. But a brat only recognizes the voice of authority and no other. Therefore, don't hesitate to use the voice of authority when dealing with a brat. Now I want to show you a technique which I think is simply priceless, and yet you won't use it very often. I'll bet that you could ask 50 students of mine if they've ever used it, and they'd probably say, oh, once or twice. And I'll bet you wouldn't get 2 answers in 50. But that you should know it, that it can be done, and that it is available to you, yes, you should know that. At the turn of the century, there was a wonderful man by the name of Dr. Henry Munro. I sometimes feel that Dr. Henry Munro was so far ahead of his time that he won't be appreciated probably for another 100 years or so. But Henry Munro knew more about suggestion and hypnosis than any man who had ever lived prior to his time. And he loved hypnotic anesthesia. He did some wonderful things with it. But the one thing he was terrible at was trying to convince his colleagues that it was any good. He did not know how to sell hypnosis to his colleagues. He was terrible at his demonstrations because he'd do such crazy things. He'd do things that I wouldn't dare to do. For instance, he would anesthetize somebody, hypnotize and anesthetize somebody, and then take one of the old hat pins in vogue at the turn of the century, stick it through the cheek, through the tongue, and out the other cheek. And doctors watching him would think he was a sadist, whereas, as a matter of fact, he was just trying to show doctors the power of hypnotic anesthesia. But you can imagine, if doctors don't even realize that hypnosis can be relied upon in 1959, can you imagine how they felt about hypnosis in 1900 and thereabouts? They would yell up to him, heckling him, "You can't do that to everybody, Dr. Munro." And in Minneapolis one time, Dr. Munro lost his temper and he said, "Devil, I can't. If I prove to you that I can hypnotize and anesthetize 500 people in succession, just as I have this patient anesthetized, will you then believe that hypnotic anesthesia is available to everybody in this wide, wide world and not believe that it's reserved for a specialized few?" "Yeah, but you can't do it," says the doctor. And the challenge was on. Dr. Munro said, there's only one stipulation I make. I'll take 500 people at random off the streets of Minneapolis and St. Paul, but you can't tell any of them that it's hypnosis I'm using. Keep the word hypnosis right out of the conversation. So that was agreed upon, and so these doctors, this group of doctors, met in Minneapolis, and off the streets of Minneapolis and St. Paul, they took 500 people at random, and Munro hypnotized and anesthetized those 500 people and proved for all time, I guess, that everybody can be hypnotized and everybody can be anesthetized. So when you hear anybody say that I can't be hypnotized, that's a lot of bunk. There's nobody in the world that can't be hypnotized unless they definitely make up their mind, I don't want to be hypnotized, I will not be hypnotized. Then that's a different thing, and even them you can get by various subterfuges and so on, because everybody's been hypnotized. They've already been hypnotized thousands of times. Well, anyhow, I want to show you the technique that Henry Munro used to make this thing work. In the first place, you must know the time at which Henry Munro lived and operated. It was at the beginning of the 20th century, and here was the situation. In 1847, anesthesia had been brought out. Oh, anesthesia was known 5,000 years ago. I'm not trying to say that this was something new, but so far as the doctors of 1847 and perhaps a couple of thousand years before, they had very little knowledge of anesthesia. And so when Morton and that gang brought out anesthesia, the churches were in violent opposition. After all, in travail thou shalt bring forth thy young, and that was a creed. All over the world people believed that. And so there were many doctors who felt that the pain that a person suffered at an operation was good for them, that the surgical shock they went through was good for them. What crazy notions they had. But anyhow, the general use of anesthesia did not occur, even though you hear it said that anesthesia came in 1847. Queen Victoria gave birth to a baby using chloroform as the anesthesia agent. And when that happened, Queen Victoria was such a powerful personality that the churches then withdrew their opposition to anesthesia, and anesthesia went into a period of indiscriminate use. When I say indiscriminate use, I mean this. Nobody knew the power of anesthesia. Nobody knew what it was. They'd never worked with it before. They didn't know, as our present-day anesthetists know, that there's a saturation point in anesthesia. They had trained nurses and practical nurses and errand boys practically doing the anesthesia. Doctors who knew no more than errand boys about anesthesia did the anesthesia. You can't imagine what the situation was like until they began to notice that person after person died as a result of the anesthesia and not from the surgery. Then began a period in which they still hadn't recognized that there was such a thing as the saturation point. This was not known. But what they did try to find was a safe anesthesia. The cliche was born, the operation was successful, but the patient died. That was born an absolute truth. And as these doctors and scientists all over began looking for a safe anesthesia, the world became aware of the search. But we still didn't have our trained anesthesiologist of today. We had this situation. Now, it was in the midst of this situation that Munro used this approach to the patients that were brought in to him in Minneapolis. Maybe I would have somebody else for this particular thing, because I just hypnotized you for something else. Let's have somebody else that I haven't worked with, because I want to show you what a potent thing this is. Well, any of you ladies want to come up? Come on. Now, as I told you, he would say to them, what is your name, please?
Mary Ann.
Well, Mary Ann, you're a very fortunate person today, because you're seeing something that is the scientific marvel of the age. I guess you know how the world has been searching for a safe anesthesia. And, of course, she had, and she'd say yes. And he'd say, well, you see this little wine glass? They found it. In this little wine glass, there's enough anesthesia there for 400 people. Would you believe that? You can do surgical operations on that little amount of anesthesia on 400 people. And the reason it's so wonderful, and the reason it's so perfectly safe, is that you don't take it internally. Oh, it smells awful. Isn't that awful? And he'd hand this noxious-smelling substance And she'd smell and say, ooh, that's terrible. Say, yeah, I know. But you see, you don't take it internally. It's merely rubbed on you, and you go into a soft, deep sleep, and it's the most wonderful thing in the world. We've already anesthetized all the doctors in this room, and now they're watching it as it works on other people. Would you like to have about 2 minutes of the softest, deepest sleep you've ever had where you lose all sense of feeling? Watch this. I just take this, and now watch. I stroke your forehead, close your eyes, and already you can't open them because that medicine works so fast. When you test them, you'll see they just won't work at all. That's right. Now you've lost all sense of feeling. And she has. She has no feeling whatsoever. And I'll prove to you that she has no feeling whatsoever. For this is the most rapid anesthesia in the world, and Dr. Munro proved it so beautifully. If you have no feeling there, you'll know I'm working there, but that's all. Now watch. When I have you open your eyes, you're going to feel better than you felt all day and all week, and your arm will feel so good. Now open your eyes. How do you feel?
Good.
What do you feel? What did you feel of what I did?
I just felt it, but it never hurt.
Didn't hurt. Closed the second notch and didn't feel it, and you saw how instantaneously it was, and all the only words I used were, now she's lost all feeling. And that was what did the selective thinking. This was the technique by which he hypnotized and anesthetized these 500 people in succession, and it's a technique that you should know is available to you. That's an awfully nice technique to know if you're working with a cardiac patient. If you're working with a patient who can't have anesthesia. Awfully nice to know that you can get a deep anesthesia that quickly. Now, there are certain tests for hypnosis, and I've told you about the 6 signs of hypnosis, but even though people see these 6 signs of hypnosis, and they see them so clearly, they still are not always satisfied that they've got a hypnotized patient. Now, we'll say that I have this patient with eye closure, and then some doctor will say to me, well, she's got her eyes closed, but is this the real old-fashioned hypnosis like you see on the stage? Is it the same hypnosis? Of course it's the same hypnosis. And they say, well, can you make a rigid arm just the same way as they do on the stage? And you say yes. Now, let's see. When I hear that said, usually it's by men who've taken 3-day courses and who have been taught that this is a sign of hypnosis. Gentlemen, the strange thing about these doctors who try to teach you that a rigid arm is a test for hypnosis is that they didn't learn it as it was used on the stage. It's stage hypnosis that they're doing, but they don't know how the stage operator used it. Now, the stage operator used this technique as a deepening device. Let me show you the way that it is used in medicine today, and then I want to show you the way the stage operator used it. I want to close your eyes. No, just pretend you can't open them. And I'm going to take your arm, and I want you to make a fist as I count to 3. Make that fist so rigid that you can't bend it. 1, make it rigid. 2, like steel. 3, and now you can't bend it no matter how hard you try. And when you try, it just won't work at all. Test it. You'll find it. Just you can't bend it at all. Now you've got the rigid arm. And this is what they say. Now they're ready for therapy. They are not ready for therapy. She's merely got a rigid arm. Doesn't mean a thing. It doesn't mean she'll take another suggestion. But I want to get depth, is what the stage operator uses it for. So the complete test was used like this. This looked dramatic on the stage. And the audience didn't notice when he said, now when I have you relax the arm, you'll go much deeper. And notice how much deeper she goes. Now you can relax. That'll relax and you'll go much deeper. Can you feel that depth? Can you feel yourself going deeper? You can answer. Can you feel it? That's the way the stage operator used it to get depth. Not just this. That means nothing. It's when the arm relaxes and they go deeper again that the stage operator used it for. But this is not a good thing to use in the doctor's office. It is not a good test. What doctor wants to have rigid arms all over his office? If you think that's good medicine, I don't. I may not be a doctor, but I know what a doctor should do in his office, and I know the semantics of good patient relationship, and having stiff arms in the office is certainly no way to handle a patient.